Dr. Bradley is also an assistant professor of pediatrics and child health at Howard University College of Medicine and a general pediatrician at Howard University Hospital. She's a board-certified pediatrician who graduated from Hampton University with honors majoring in biology. And there's a lot of other accolades here. She is an amazing doctor. She received board certification in holistic and integrative medicine in 2009, and she's additionally a member of the American Academy of Pediatrics section on integrative medicine. So she's quite a remarkable person. Thank you so much for sticking around for Dr. Bradley. Please give her a warm welcome.
And thank you so much for staying and listening. I really am feeling so honored and privileged just to be with you all. I want to just kind of put a plug in there. I'm not your ordinary doctor, so I did not take offense at all the doctor bashing and all the that has happened since I've been here. I understand, and I've been in the position of being a patient too, so I think that that has really helped to soften the blow. So I'm going to actually go through the slides quickly because I know we don't have a lot of time. So what I do want to talk about is its approaches that are holistic and integrated, pretty much. We've talked a little bit about some integrated physicians, and that is one of the things that I do, to allergies, asthma, and ADHD. And we're going to review what's called the 4 A's as described by Dr. Bach. And I had brought the book just in case you guys want to. I don't have a book yet, but I do want you all to be aware, and there is information that's great in this book. So a lot of what I actually have put into this slide study comes from this book. What the 4 A's are include allergies, asthma, ADHD, and autism. But because autism is a really big one, I really kind of wanted to stick to this, but there's a lot that has to do with that's the undergoing, that they all have in common. And we're kind of going to go through what the whole cause issue is. So I apologize, but I don't, I don't. Because I do think it's important for you all to have all the information you can. I think that it was one of the speakers had talked about just being your own doctor. So I'm going to give you a little medical school training and help you with understanding some of the science. So some of the questions that you have, please ask them afterwards too. But we'll go through some schematics that make it a little bit easier to understand. We're also going to talk about the gut microbiome. Have you all heard of that? I know we talked about leaky guts. I've heard that kind of spoken around. Have you guys heard of the germ theory at all? Anyone raise your hand? Okay, some have heard about the germ theory and the connection of that has to immunity. And I mean, Brandy spoke about how nobody figured out that we're doing the gut and the health. We are doing it at Howard. We're trying to teach some people some things in medicine. And actually, most medical schools now that are training, and there are a few new ones, they do have curriculum that are specifically geared to holistic and integrative medicine. And we also at the NIH have the National Center for Complementary and Integrative Health. So we're trying, guys. Work with us. But you are the ones that are driving the industry. So we really appreciate everything that everyone has to say. And then what I'm going to do, is, especially from this book, is discuss what we call 3 elements of ADHD, allergies, and asthma. I talked about the book. So I want to talk about Venn diagram. This sweet spot here is the thing that it has in common with, this is a pointer, right? With autism, ADHD, allergies, asthma, mood disorders, obesity, type 1 diabetes, you name it. They all have to do with these 3. The immune system. We talked about inflammation, which is related to that, whether things are too inflamed or not inflamed enough. Digestion, the gut health, and we talked a lot, I've heard a lot lately about the detoxification. So the common contributors of these, and I feel like I'm just doing a review course of the last few speakers, which is awesome, which makes now I'm going to be able to move through these slides a lot faster. But increased exposure to toxins, decreased detoxification capabilities, and decreased function of the immune system and the GI system. And they all have to do with brain function. So there is that connection, and we finally, yay, have figured it out. So there's genetics as well, and I want you guys to realize that genetics is not just a 23andMe. There are things called epigenetics. There are things that influence the genetics. They turn genes on, they turn genes off. So it's really complicated, and science can get really complicated, and it can get really like minutia of information. But the thing that we know is that there's nutrition affects genetics, and toxins also affect genetics. And of course, the environment affects genetics, and these include air pollution, pesticides, all those toxic things. Over the last 20 years, and you guys have seen some of this data as well from the previous speakers, we have a 15-fold increase in autism. ADHD has a 400% increase. Does anybody know a child that hasn't been diagnosed with ADHD? Anyone? Anyone? Anybody know a child? You know a child that has never been. I mean, I'm saying, do you have any children that you, I guess I'm not saying it right. Are you all familiar with a child that has been diagnosed with ADHD? You all have been familiar with a child who's been diagnosed with the asthma and allergies, as well as autism. Anybody has never seen a child that was diagnosed with autism. So it's really sad that we have all these increases. And we're going to talk a lot about, and I do want to say that all of our speakers are very much on target. And again, I would be abandoning the Academy of Pediatrics, which I am a fellow of, and I pay dues every year, but I also, I do. But I also have to make sure that we're helping everybody stay fully understanding of what is going on. So Dr. Bach, who wrote that book that I talked about what we call the Immune Kettle, where there's imbalances, there's symptoms, and all of these disorders. You name it, fibromyalgia, all of the autoimmune issues, they have an effect. And all of these things interact together to give you all this imbalance. So your infectious agents, this is huge, guys. I know I heard that one of our speakers had the Lyme disease. Infectious agents are very important to know about. Environmental toxins, hormone imbalances. Like I said, I think, what was her name? Andrea? No, it was, I wrote them down. Amy. Amy was just like basically speaking my whole talk, because her whole story was Valpone. It was basically everything that we are doing pretty much in integrative medicine. So I do want to go over this. I'm a pediatrician, so I'm all about what happens in the beginning of life, and I'm all about what happens to the mom, like even before I see the little baby. I'm on the catching in, is what I say, but I do need to know what's being pitched at me and what is from the OBGYNs before I know what happens with my babies and how to manage them. So, you know, we have these early life exposures, and we like this. Infant guts are supposed to have microbiota, okay? Now, what affects it? Sometimes it depends on if a child's born by C-section. Sometimes there are indications for that versus a vaginal birth, whether they're breast milk or formula fed, the microbes and substrates, and even breast milk with pump milk versus that skin-to-skin contact is very important. Maternal and infant antibodies and antibiotic use, So the use that mom may have because she's had a urinary tract infection or something that happened with the baby, they had to stay in the nursery because they had sepsis, that actually kills the infant microbiota. And these microbiota are really important because they actually are responsible for making vitamins, and they're making hormones, and they're making neurotransmitters. So it's really important that we have an understanding that these are the effects. Sometimes they're unavoidable. So I don't do guilt parenting. So everybody that has vaccinated your kids or had to have a C-section or had something that happened, you know, that is just the path that your child has. That's the path that you had. If you're trying to be that person that, oh, I'm going to be mad at this person because they're the ones that caused that. Well, there's the end of the story, and there's a journey. And I do believe that everybody has a journey. You have to figure it out. It's very personalized. So I don't want you all to feel badly if any of these things were the course for you or your child. You know, being around pets, it's supposed to be a good thing, actually. The hospital care, more siblings you have, the better, supposedly, and daycare. So these all actually, when it's particularly this aspect of it, they actually lean the tip of the iceberg in the immune system more towards food allergies and asthma and also autism and other diseases that we see in our type of country where we don't have a lot of exposure. I do want you guys to have this also. Again, we talked a little bit about the oral mastication. Remember when people used to just kind of chew the food up and give it to the babies? Anybody know about that? Some of you still should and do. That's fine. Matter of fact, the American Academy of Pediatrics, there was a study. The mothers that had the pacifiers and they licked the pacifiers and put it in the babies, they had better immunity. So, you know, since it's not a bad thing, mother saliva sometimes can help babies. So selectively, actually, mammary gland, that skin-to-skin contact is very important. And then again, passage through. So sometimes what we do is we block all of these wonderful things that are supposed to help that the microbiological transmission from the mother to the child. It actually, we block it with different things, bottle feeding, with C-sections in early life, antibiotics, and early extensive bathing. I just wanted to put this up so I can tell you that we all are just a bunch of, we are an organism that have a bunch of organisms on us. And they're microorganisms. And I'm talking about bacteria, fungi, molds. There's a lot of things that are on us, and sometimes they need to be on us, and they have a nice little balance. So you can see, and they're in our hair, they're in our nose, they're in our skin, they're in the vaginal area. Again, that's why I put this up here for the child. You see that in the next slide. The oral cavity, the esophagus, the stomach. And so all of these are the gut. And you see there are different parts of the gut, depending on whether you have what's called H. pylori, totally beyond the scope of this talk. But they have different amounts of these good bacteria that are supposed to be helpful in the microbiome, protecting us against pathogens, interacting with the immune system, and digesting enzymes and activity, and then also the synthesis of vitamins, as we said before. So I want you guys to see this. It's supposed to be balanced. When we have the immune system, like if we get an attack, we have good immune regulation. Okay, but a lot of times because we're so clean, this is pretty much like what some of you have heard of the germ theory. We're so clean, too much hand sanitizer, too much everything. Oh my gosh, don't touch that until you touch the baby. Nobody's like letting the babies play in dirt and all those types of things. We're not exposed to the parasites and other things that actually work on this side of the immune system, which actually balances it, what we call the immune attack. It's important sometimes that we are exposed on this side. And this side actually is a part of the immune system that we call the Th1 helper cells. Now, if that doesn't happen, then we get kind of imbalanced. These are the 2H2, which are kind of more responsible for the regulatory cells. And when we see this kind of imbalance where the immune system is not really greatly attacked, we actually start turning on immune regulation that leads us more towards what we call atopy or allergy or asthma or some of the other things like type 1 diabetes, and it's a reaction. And that's also shown here. This doesn't show up pretty well, but this kind of talks about westernized countries where that imbalance that I showed you before, when they're not allergic, the allergies disorders, asthma, eczema, rhinitis happens more because when they're smaller families, more affluent urban families, when the intestinal microflora is pretty stable, they say, but and there's high antibiotic use, low helminth or parasite burden, and good sanitation. So in a way, the germ theory says that we've kind of created this ourselves. But we know that there's a childhood connection to this because children with autism, they also have ADHD traits. They also have some allergies. There are higher incidence of asthma in children that have autism. Children with asthma actually have higher ADHD rates, and I don't know if that's because of the steroids and the beta agonists, the albuterol, the inhalers that we put those kids on. Have you guys ever had a child with asthma and you give them that albuterol and they just run all over the place? Yeah, that used to be actually when we knew the child was ready for discharge and when they were hospitalized, when they were able to get out that bed and just run all over the place. We were like, the asthma attack's over. That was how we were treating asthma. A lot of asthmatics have reflux, and I see so many babies with reflux, gastroesophageal reflux. Have you guys, we used to just call it wet burps and everything, but there's a lot of kids that I see that have that, and a lot of kids that have these food allergies, as we said. A lot of children with asthma definitely have allergies, and et cetera. So the allergies and asthma during mother's pregnancy doubles her chance of having a child with autism. Very interesting statistic. And then mood disorders, lots of that going on. ADHD, autoimmune conditions. They usually run in the family with autism. So let's talk about element 1, diet and nutrition. I'm going to kind of go through this fast because I know I probably don't have too much time. Okay, so we're going to talk about the gut health. Okay, we talked a little bit about leaky guts, and you guys kind of have this because it seems like this conference was pretty much all about this. So I can skip through this part and you guys can ask questions later. So remove foods that inflame the gut, add foods that heal the gut, nutritional deficiencies, there's quality and digestible foods. A lot of times you guys heard about I've called it Candida, but everybody in this arena calls it Candida. And okay. So anyway, I call it Candida. um, so remove the sugars and those types of things. And the toxicity, you want to get yourselves, avoid food additives and avoid toxins in food supply and meal preparation. And then faulty methylation. We talked about that MTHFR, methylation, that is, and sulfation, that is another thing. And I have that schematic in a later slide. I'm actually going to go quickly to it because most of these you guys have already gone over. But I do want to make sure that you guys have a little bit of an understanding about gluten and casein sensitivities. It's not just that the gut's sensitive to it, and there is a difference between an allergy and a sensitivity. Do you guys understand that? That an allergy is something where you have what we call kind of more of an anaphylactic response. A sensitivity is kind of what mostly affects your leaky gut. Okay, so it means that your body just doesn't like it. And if you do a test, it actually will be immunoglobulin G. So you've been exposed to it. So there's IgG and there's IgE. Allergies are IgE, and then sensitivities are more IgG. We can talk about it later if you have questions. But I did want to get on this, is that have you guys ever heard of an opioid effect of having okay, so we have like 3-year-olds that love chicken, I get them, it's just the brown yellow diet. Chicken nuggets, macaroni and cheese, pizza, it's a little red in there. But and that's what they want, McDonald's, French fries, There actually have been studies, especially like the cheese and the casein, that have shown that there are actually kind of substance opioids, which is an addictive substance and we have cells that get upregulated that say, eat. So they crave that stuff. And they get upregulated pretty much when they're exposed to things like the bovine casein. Sorry. And then we also see that there may be that part of the treatment, possible etiology, meaning the source and treatment of autism. So these are some of the studies. I'm sorry, I'm a doctor, so I do kind of get scientific-y. So we'll move on to this slide. But again, the food sensitivities, we talked a little bit about what those causes and the differences are for those. Let me see. And the connection, pretty much. Everybody knows soy, corn, eggs, citrus, and peanuts and nuts. And this is a lot of times when I have my infants that have like eczema or that really stuffy noses and they're breastfeeding, sometimes I ask moms to kind of do a little bit of a test with an elimination for some of these foods, not just gluten and casein, because they sometimes can be something that may be messing with the kid. You guys probably can always get these slides because I'm going to move a little faster, because I think we've done this. Now, I did want to point on this. There are actually kids, you guys know kids that just won't eat certain things. They're real picky, They're not, I actually was a picky eater when I was young. I went through phases where all I wanted was carrots. And we would go, and that's all I would eat were carrots. And all I wanted and I used to lick salt. So that anybody that knows about adrenal fatigue, that was the hint there. I used to be on the table and just lick it. So, we all have our little pickiness, and I was one of those picky eaters. Well, sometimes it may be, again, they're like, I am not eating anything until you put that French fry in there, and they're pretty willful. Children are quite willful. Anybody have a willful child or no one? So that's pretty much that, and it's primary wheat and dairy-containing foods. Addictions to chemicals. So there are addictions to that MSG, the artificial additives, they cause restriction to one brand or another. And processed foods. Sometimes it's actually a nutrient deficiency, particularly zinc, because if you're zinc deficient, that actually can sometimes make food kind of it's pretty bland and or bad even. Yeast, viruses, microbial they actually also lead to why they're picky and may actually go right back to that opiate effect with high carb and sugary foods. And then there are sensory sensitive children that don't like those kind of textures, very textury. I have a little bonus grandchild. He's a textury kid. He makes a face the minute he starts something, but we keep introducing it to him. He's so beautiful too. But I start looking at him. I'm like, okay, we're going to keep watching this, okay? But some kids really don't like those textures. You want to keep the nutrient-dense foods. Again, my slides, I guess, will be available so that we can move fastly. But this kind of gives you some of those things. But again, you guys I'm not the nutritionist here. I'm the pediatrician, so we're going to keep moving on for that. But click, everybody, last click. Uh-oh, iron. Got that one. Okay. So again, I'm going to go through some of these, and again, I knew I didn't have a lot of time, but I want you guys to have the information about a lot of the things that help support the immune system and what to avoid. So here's my deal. I love cod liver oil. Does anybody here know about like just having to take it like as a kid, like, ugh, you know? They got better tasting ones now, you know. Yeah, the flavored ones, and some kids are really like, I don't want that. They like, the parents have to hide it high in the cabinet so that they don't know, or hide it really, so that the kids don't get them, so they're better. But they have a lot of vitamin A and D, a lot of protein. Okay, so probiotics, really important. We talked a lot about what happens in the beginning of life, where that microbiome is supposed to be established, and how we have all these clean things and other things that happen to us. We get in a cold, antibiotics, and it kind of destroys all that gut microbiome. Well, probiotics are really helpful, and we've seen a lot that helps a lot of kids once they get that kind of gut microbiome pretty well. Their allergies clear up, their asthma is better, and then especially the kids with the ADHD. And I think that ADHD, those kids with the ADHD, they really definitely, I have one, I'm sorry. I have a kid with ADHD and some other issues, learning disabilities and all that kind of stuff, but she is so addicted to food. And it's difficult to kind of help our own kids kind of pass that. So I'm there with you, okay? I love raw honey. Honey, we've done studies with honey, even in pediatrics, where honey, because of the bee pollen, and they did it with dark honey, compared to one of the cough medicines, cough suppressant medicine, dextromethorphan, and actually the honey won. And they were like, oh, the big title on this, it was in Pediatric News about 10 years ago, Pediatric News. A spoonful of sugar seems to help, is what they said. But they said, not sugar, psych, it's honey, where the honey actually helps suppress a cough, and there are phenols in that and anti-inflammatory properties within the honey. And again, antimicrobial types of action against that. And the local honey helps with allergies. Like if you have somebody that has a local honey supplier, usually the ones that, if you know what kind of things your child is allergic to, and the bees are there, the raw honey that's there really can help. And of course, we heard ginger and garlic. Oh, sorry. Seaweed and shiitake mushrooms are also good immune supporters. Okay, so these are the anti-inflammatories. Omega-3s, which are found in all of these foods. Olive oil, all of your antioxidant foods. I usually tell kids, you know, I put the youngest kid that knows how to count and knows their colors, usually about 4 or 5, responsible for the family eating their rainbow-colored foods. I want to see oranges. I want to see blues. I want to see, you know, something green, definitely, not just brown and yellow, and Skittles don't count. So that's really, you know, important, you know, and start to explore. That way kids get exposed and they're really excited about it. Quercetin is really good, and it's found in, and it's really anti-inflammatory. And then certain spices like turmeric and cumin, we know, and ginger and garlic we talked about in the probiotic-rich foods. You want to stop the pro-inflammatory foods, which are down here. And let's see, where are we? Okay, I got this. Anybody do Pinterest? I'm sorry I had to borrow Pinterest, sorry. I just used a graphic. This is Dr. Axe, so I'm giving him a shout out. It's in one of my other slides, so I don't want to be thought of as somebody that steals stuff. But this pretty much gives you a nice summary of foods really to avoid, particularly not just for allergies, but just for people that have that hold on to toxins and things like that. We're going to get into that in the next section. So supplementation therapy. Again, food is great, and you can get food, and you're able to do cofactors. So you got vitamins, minerals, and all of these other factors that are helpful. But sometimes it's not fully always enough. I hate to say it. Especially the way that our food is within the soil that we use, the industries that they're in, the pesticides, the hormones. Even if you go organic, it's so hard. So I usually do say that it's just difficult. But supplementation's good and often is essential, particularly when you need therapeutic doses. There's a difference in just regular, like that healthy dose, and a therapeutic dose. For instance, a child that has ADHD has an increased need, and this has been shown, for essential fatty acids, EPA, and DHA. That's just been shown. They have that as a deficiency. And it really doesn't help if they just get it a little bit, like as part of their supplementation, so they might need higher doses. And they might actually need help with certain proteins and amino acids like phosphatidylserine in order to cross what we call the blood-brain barrier. So sometimes that's why we need supplementation. And those can be found in certain things like medical foods that we have. Okay? So, but both are healthy and important. So you can't just give the child pizza and then give them a whole bunch of, well, I guess you can, but you know, you guys get what I'm saying. And then think they're going to be cured. You know, Dr. Bradley, that's not working. What are they eating? Oh, and I see them there with McDonald's, or I see the mom will hide, like, you know, with the, yeah. Okay, anyway. So here, like I said, I told you I was going to give him a shout out, Dr. Axe. Spirulina, and so these are allergy, anti-inflammatory foods that are really help, or supplements, I'm sorry, that really help. I want to highlight what we call histamine. You guys know what antihistamines are? Benadryl, Zyrtec, Claritin, Allegra. Those are all antihistamines. Well, you have other ones that are antihistamines, and they include the spirulina, the stinging nettle. And this kind of gives you an idea. These would be adult doses. See your pediatrician if you need help with dosing. And then helpful supplements. Sometimes we need to have some digestive enzymes. I talked about cod liver oil. And then sometimes we need extra amino acids. And sometimes, okay, so the methylation. I think I'm going to get into that next. Detox, yes. So metabolic end products, toxicants, hormones, and acetaldehyde. That's actually a byproduct of yeast. Everyone has these toxins, but some of us have more of a problem getting rid of it. For example, what Ms. Valpone was talking about. She just, and her legs were swollen up, and she just had a real problem with getting rid of it. And a lot of people have that, especially if they have infections, people with Lyme's disease, people that have extra strep, people that have extra attacks with certain viruses. It's just harder because your body's like, ooh, I don't know what to do. And it's like, never mind. Then your liver's like, what do we do? I don't know. Your kidney's like, I don't know. You know, and then you're like tired, so you're not doing anything else to detox because you're not sweating, you're not moving. It's just a hot mess, okay? And it just keeps going. It just happens. Trust me, I know. Again, the microorganisms. So there are microorganisms that are good, and then there are those that we're like, ooh, they're really not good. They're not healthy for us to be totally exposed to because they release these toxins. They change our genetics. They do all kinds of crazy things. But it's hard to know which ones are actually in play. So everybody is different. And I loved how a lot of the speakers were saying that everybody is different. So you become your own physician. You know, and for me, I'll be honest with you, I pray a lot. I look at the great physician because I'm like, I don't know what's wrong with these people. You know? I got to pray. They're sitting there telling me everything. And I'm like, Lord, you know, you're omniscient. And that's just the way I have to practice medicine. You know, I'll be knocking on the door and I'll be like, thank you, Lord. You know, help me with what's going on. Okay. Fungus, if you have a child that you just can't, no matter what they're on, all these steroids, especially if they're on steroids, fungus is huge. And so really the treatment, so you want to look at their mold, the piping. You want to look for black mold. You want to look for places where there are leaks. And because this is really bad for children with asthma and allergies. I actually, in one of my offices at Howard, I have black mold there, and I told them about that. And I actually have been on an inhaler for the past, like, every time I go there, I want to cry. And I haven't been in that room since because I know that place is emotionally and everything. So, we're contaminants, metals, and everything. I wanted to get to this slide because you guys, okay, again, I'm sciencey. The people that have autism spectrum disorder, so methylation, this is what happens. They have less homocysteine, and they have increased and less methionine and SAMe, which is a lot of times what we have that helps with what we call, I like to call it like greasing the nervous system, where it helps with nerve conduction. That's what myelination is. It helps with nerve conduction. And it makes it harder for cells to transfer their own energy, and it increases all of the allergic reactions. And then there's the sulfuration, which I talked about a little bit. So a lot of times there's decreased sulfite, which is not good. Sulfate is good, it's processed. And if you have that low, you have poor digestion, poor detox and everything. Glutathione, a lot of times this is used for detoxing. And, okay, my time is up. I like that slide, that's sorry. That was my sciencey slide. Okay, so we're gonna go here. You guys know about those types of things, detoxing agents and detoxing methods. I talked about sweating, exercise, and infrared saunas. Those are important to help with detoxing methods. Sometimes we have to do IV therapies like vitamin C and glutathione, and then sometimes chelation is necessary. And that is something that's outside the scope of this talk, but I also want to really just quickly touch on mind, body, soul, and spirit, because there's detoxing that has to happen with that as well. And there are mind-body modalities for that, like mindfulness, meditation. Everybody did yoga this morning, and then breathing techniques. I'm not going to have enough time to go into the Buteyko method, but this book actually talks about that. It's called Asthma Free Naturally, where it actually helps you train your way of breathing. That's a little bit different. And I did have a demonstration for that, but clearly I didn't manage my time right. And then there are energy modalities. Reiki, we talked about acupuncture, we talked about acupressure. Homeopathy actually is an energy medicine. Okay. And so we're going to keep it on. These are some natural oils. And the conclusion, pretty much everything's linked together, genetic vulnerability, toxins, and everything. And everything's treatable, and sometimes some people think can be reversible. But using these treatments can help change behavior. You just have to educate yourself. And I've been told I am done. So thank you all.